Hi, I'm Dr. Steve Bonasera, and I've recently taken the position of the Division Chief of Geriatrics and Palliative Care at Baystate. And I'd like to tell you a little bit about the many of the things that really make me excited about taking this position. First of all, just like when you move into a new house, there's a few little things that we want to make sure we get fixed up before we start doing any major renovations. And the major things that we want to look to is we want to look at the services that are currently available to our inpatients. These are services like our ACE unit and both our palliative care and our geriatrics consult service. And we want to really make sure that those services are really strong in terms of their availability and the time between when a consulting doctor might ask for them and when they actually get that consult. ACE units are these tremendous organizations that basically take into account the idea that hospitalization can often, while helping older adults, also put them in a situation where they lose strength, they lose mobility, and it becomes harder for them to go back to their prior status. And the ACE unit is built to make sure that we find these adults who are at risk of losing function while hospitalized and keep them really buffed up so that when they are not only treated for their acute infection or their acute illness, that they can go home without having troubles doing things like preparing meals for themselves or being able to use the bathroom. We know in Western Massachusetts that the overall population is older than what we expect in the rest of the country, and that they're going to need services that older adults require in a quicker time frame. So we're going to be building in the next few years a set of offerings for these folks so that they'll be able to access a lot of their care at home. And that, I think, is going to have a tremendous effect on both quality of life for those folks, but also more subtly in how we spend money in Massachusetts in health. Because if we can keep folks healthy at home, we're more likely to keep them out of the emergency room, keep them out of hospital rooms, and ultimately save money for the institution and for the people who pay for this health care, while at the same time providing better care for the folks who are utilizing it. The third thing I'm really excited to do is to be able to continue to provide in this community high-quality dementia care. In the past, the Department of Behavioral Health has done a tremendous job of addressing the needs of Western Massachusetts in terms of identifying what are causes of many memory problems that families are dealing with and how to manage them. I'm really delighted to take on the role as the director of our Memory Assessment and Care Clinic, continue to provide those services, but also be able to integrate some of the new programs that have been funded by Medicare and through the NIH that are focused on improving the care of patients and families that are living with dementia, and bring those programs and the wisdom and expertise that they embody to our families living in Western Massachusetts and who are cared for at Baystate. On a final note, I want to just tell you how much philanthropy means, not just to myself, but to the people who we take care of. It's with philanthropic dollars that we can essentially build these new programs. Medicare is a very lean funding machine. It pays for care that we are capable of providing right now. But new programs to be able to take care of people where they're at and to take care of the new needs that we identify, those are basically not possible through Medicare. And in an institution like Baystate, where we don't have a multi-billion-dollar endowment that we can lean back on, that really means that we need to lean on the philanthropy of the members of our community. The money that comes from philanthropic donations, you will be able to see reflected in the improved health, well-being, and quality of life of the older adults that we're able to reach. Thank you very much.